normal sinus rhythm looks like. In normal sinus rhythm, the peak to our interval is from 0.12 to 0.20 seconds.
Party don't start till I walk in. Don't stop.
Okay, and in a first degree block, the PR interval on the surface of the ECG is measured from the onset of the atrial depolarization, which is the, I'll get down. They measure it again from the P wave to the QRS, and the distance should be anything above 0.2 seconds. When it's at 0.3 seconds, it's considered a marked first degree heart block. Everything is normal in them, it's just slower conduction.
Heart block is a problem that occurs with the heart's electrical system. This system controls the rate and rhythm of the heartbeats. Rate refers to the number of times your heart beats in a minute, and rhythm refers to the pattern of regular or irregular pulses produced when the heart beats over time. With each heartbeat, an electrical signal spreads across the heart from the upper to the lower chambers. As it travels, the signal causes the heart to contract and pump blood. This process repeats with each new heartbeat. Heart block occurs if the electrical system is slowed or disrupted as it moves from the upper to the lower chambers of the heart. It is a type of arrhythmia or any problem with the rate or rhythm of the heart.
And this is what a first degree EV block looks like.
Don't stop, make it pop, DJ blast, records on, fight till we see the sunlight. Set on the clock, the party don't stop
One of these patients looks like the others, but she is not. There's an illness growing inside of her, emanating from her heart, eventually radiating and affecting everything about her. And yet she looks normal. She feels normal. The only indicator that there may be a problem might be her heart rate.
So symptoms are rare. You're usually asymptomatic. Only patients with symptoms are athletes, usually short of breath and dizziness after exercise, and that's due to lack of oxygen from the body because of decreased heart rate can cause syncope.
Risks and causes for include, there's actually a lot of factors that contribute, such as diseases, exposures to toxic substances, surgery, medications such as digitalis or beta blockers, and other conditions such as congenital heart defects and lupus. The most common cause of acquired heart block is damage to the heart tank. Other diseases can cause heart block, including coronary artery disease, myocarditis, which is inflammation of the heart muscle, heart failure, rheumatic fever, and cardiomyopathy. Other diseases include sarcoidosis and degenerative heart muscle disorders, Lev's disease, and Lanier's disease. Obviously, anybody who suffers from any of these conditions is at higher risk to develop heart block, but what is interesting is that athletes do get it because the increased activity increases stimulation of the vagus nerve, which slows down heart conduction. And in most cases, if you can remove the factor that's causing AV heart block, you also remove the AV heart block itself.
Alright, so there's no treatment for asymptomatic first degree heart block, so there's no hospitalization indicated either. But if it does become symptomatic, if the patient's on any medications that could potentially cause the block, they should stop those. And then also if it is symptomatic with severe bradycardia, medications such as atropine and isoproterenol, along with with a possible cardiac implant, cardiac pacemaker. So basically what atropine does is it shortens the interval between the P and the R by improving the conduction and increasing the heart rate and increasing the cardiac output. And isoprostol shortens the AV conduction by increasing the heart rate and the contraction, increasing the cardiac output. And then pacemakers are considered for patients with or without symptoms when they're present with neuromuscular diseases, such as myotonic muscular dystrophy, ERV dystrophy, or peroneal muscular atrophy, because they may experience unpredictable progression of AV conduction diseases. And then if symptoms of syncope or heart failure are present with the block, then electrophysiology consultations may be indicated. And then basically what that is, it's a test that records the electrical activity and the pathways of the heart, and it helps the doctor determine the cause and the best treatment. The doctor reproduces an abnormal heartbeat and rhythm and gives the patient different medications to see which controls best and determines the best procedure or device to treat the rhythm. And then follow up with an ECG to monitor progression to a higher rate AV block.
Alright, so the first degree AV block is characterized by a long PR interval greater than 0.2 seconds. Then this may also progress into second degree AV block, which has two types. The first type is Mobitz 2 or Winky block, which is characterized as having a gradual lengthening of the PR interval until a QRS complex is dropped. So they're saying that Dr. Heyman taught us is longer to drop, what you got is Winky block. So that's type 1. Type 2 is Mobitz 2. It's characterized by a variable blocked QRS complex. You can have varying ratios of P waves to QRS complexes, sometimes 2 P waves to 1 QRS, or 3 P waves to 1 QRS. So that's just, the PR interval doesn't get longer, just all of a sudden QRS is just lost. Then this can also lead into third degree AV block, which is also called complete heart block. It's characterized by dissociation between the atria and the ventricles. There are normal P waves and normal QRS complexes, but they're going at their own rhythm, and this is serious and